If your leg pain simply will not go away, it might be because of this one problem that most treatments completely overlook. I've seen patients with severe L4-5 and L5-S1 disc problems go through therapy, injections, even months and months of exercises, but the pain, it just keeps coming back. Not because they're not trying hard enough, not because they're doing it wrong, but because the mechanical pressure inside the disc is never fully corrected. In this video, I'm going to show you what has to be done and what has to be targeted at the disc level if you want to get rid of this leg pain finally and let it calm down. If your leg burns, goes numb, feels unstable, make sure you watch this video to the very end, because missing even just one of our strategies could be the reason why your leg pain keeps coming back. Hi, I am Dr. Chris Cameron, a chiropractor in Lucan, Ontario, and a certified spinal decompression doctor. I help people with conditions like disc bulges, herniations, sciatica, back and neck pain. I help them to get out of pain and get back to doing the things they love to do without the use of drugs or surgery. On this channel, I share practical strategies to help you strengthen your spine, protect your discs, and move with more confidence. So if this sounds like you, make sure you subscribe so you don't miss any future videos. Here's the problem most treatments never correct. If the pressure inside the L4-5 or L5-1 disc does not change, your leg pain, what is actually causing the problem, sciatica, it will never truly heal. The pressure doesn't just show up overnight. It builds slowly over months and years from things like poor posture, spinal misalignment, and uneven loading through the spine. As the pressure builds, the discs start to weaken and push backwards, eventually pressing into the nerve. You can reduce inflammation with medication, you can strengthen muscles with exercise, and you can stretch to improve mobility. And that helps temporarily. But here's what I consistently see. The disc is still under pressure, and every time you sit, you bend, you stand, that nerve pressure, it goes up and the nerve gets irritated over and over again. The real question becomes, what actually reduces the pressure inside the disc? This is where non-surgical spinal decompression comes in. This is not just stretching, and it's certainly not just standard traction. It's controlled, computer-guided system designed to create a negative pressure inside the disc. And that negative pressure is the key. It creates a vacuum effect that helps you draw the bulging disc material and herniated disc material back inwards, taking pressure off of the nerve. And when the pressure decreases, the nerve finally has a chance to calm down and heal. But here's where most people get it wrong. Changing pressure once, it's not enough. If you don't stabilize the spine, correct the alignment, and fix the underlying mechanics, the problem, it just simply comes right back. That's why in our clinic, we don't use spinal decompression as a standalone treatment. It's part of an 8-step protocol, an 8-step system called the Backstrong protocol. We address disc pressure, spinal alignment, load distribution, nerve irritation, and long-term stability. Because when you treat the root cause, results become more consistent and more sustainable. In fact, 78% of our patients with back and leg pain experienced a 50% reduction of symptoms within a 3-month period last year. That's based on documented outcomes in our clinic. Now, the next question is, are you actually a good candidate for the service? To determine this, it has to start with a proper evaluation. We look at your movement, your spinal alignment, x-rays, your MRI, and take a complete and full history, because not everyone is a good candidate. If someone has severe neurological symptoms like complete loss of bladder, complete loss of bowel control, or saddle numbness, that's a medical emergency. But luckily, most people don't fall into this category. They have persistent leg pain, numbness, tingling, some burning or weakness, but not severe nerve damage. These are often the patients who respond extremely well to a structured decompression-based approach. So at this point, hopefully you can see that leg pain is not just inflammation, it's mechanical pressure inside the disc. And that pressure, if it never changes, the nerve will keep reacting. Non-surgical spinal decompression is often the missing piece, but it works best when it's part of a complete system. If you want to see exactly how that system works, watch the next video. I put it up here. I break down the full Backstrong protocol step by step, so you can understand how we combine decompression, laser therapy, rehab, and stabilization exercises into one coordinated plan. Go ahead and watch that video next.